Our guest today is Mary Jensen, and the topic is Senior Oral Health, the Oral Systemic Link. And we are just delighted to have Mary. We've enjoyed.
Well, thank you, everyone.
It's already been great over coffee this morning. And this topic we have never, ever in over 5 years discussed.
Okay.
So we're looking forward to it.
Well, I'm happy to be here. Thank you for the invitation.
So how about starting off telling us about your dental hygiene career and how you got into this?
Sure. Well, I am a registered dental hygienist. I've been a dental hygienist for 38 years. Most of that was in private practice, working in a dental office, doing dental hygiene work, dental cleanings, fluorides, x-rays, all that, and providing patient education. And then about 4 years ago, I learned about a company that was providing weekly oral hygiene care for dependent seniors in assisted living and memory care communities. Cool. And around that time, my aunt went into memory care. I was her power of attorney, and the world sort of collided at that point. And I really saw the need for oral care for seniors in these communities. And I thought, that's a perfect marriage.
Cool. That is so cool.
And so what brought you to do the work you do now with the seniors?
Well, again, I saw the need that with my aunt, and there are so many programs for children with dental care. If you think about it, there's Head Start programs, there's sealant programs, there's fluoride programs. There's not a whole lot for seniors. There really isn't. There really isn't. So by getting in and getting involved in doing educational presentations, it's just to kind of give them the information to help them go forward and stay as healthy as possible.
And when, Kathy said, we're very excited to have you because this is something that probably hasn't been really thought through totally.
Correct.
Though there are services out there and things like that, but this should be a major part of the seniors' health care regimen. It
should. So part of what we also want to get out to the public is everybody should ask their dental provider. Go when you're at your dental home, when you're seeing your dentist and your dental hygienist and the staff at your dental home, ask them, I'm retired now, let's say in how many years, I can't get here any longer. I can't make my way to your office. How are you going to continue to care for me? Let's start that conversation now. Let's get that going so we can put some pieces in place to make sure that we're still be able to provide care for everybody who needs it.
Sure.
What can you tell us a little bit of background on the alliance that you're a member of? Yeah.
So the HyLife Oral Health Alliance was a company that was started by Angie Stone up in Edgerton, Wisconsin, and her mother-in-law and her grandmother went into assisted living, skilled nursing care, and she just noticed that their teeth just basically bottomed out. They had a lot of problems with their teeth, and she was frustrated by that as a hygienist. She's like, this is not right. I need to do something about it. Let's back the train up and say, let's put dental hygienists where they're needed most, providing the preventive care on a much more regular basis. So the studies were put into place, and it was developed that this weekly visit, providing the oral hygiene care, the brushing, the flossing, the interdental cleaning, whether it's a brush or whatever it might be, and the use of some other products, dry mouth sprays if needed, to keep the mouth, keep the oral, the oral health as healthy as possible, to keep that individual as healthy as possible. As we talked a little earlier at coffee, there is a saying, dentistry is needed when prevention fails. So let's provide that prevention, especially for our seniors who can't do it for themselves.
That's right. We're taught about this our whole lives.
Correct.
Okay. And, and I'm sure we were talking about that this morning, all the instruments that can help oral hygiene, that helps you keep you out of a dentist chair to have repairs and things like that. I can't remember when the last filling I needed was because of hygiene care. Right. And then it brought back a memory of my mother-in-law, okay, that she had trouble doing this. Now we're in the business, right, of taking care of seniors, and we did, we were taking care of mom the same way we would take care of everybody else. But the one thing I have to say, her biggest challenge was dental hygiene.
Correct. There are so many factors that go into just, you think, oh, it's a simple task. I'm going to brush my teeth. No, it's not. If you have cognitive impairment, if you have arthritis, if you have vision, spatial things, just timing. I mean, we can all time a minute or two, right? But maybe some people can't. So they think they did it for a minute and it was 2 seconds maybe. There's a lot of factors that go into it, but good point. Good point.
Well, and also with the disease factor, I know my brother had diabetes and he ended up losing his teeth as a result of that.
Mm-hmm.
And so I imagine that happens a lot in assisted and independent living too.
Well, you could look at all the health issues that might be going on with an individual. And I could run through the litany of all the things that are associated with oral health and overall health. Arthritis. They're finding the same bacteria in the joints of arthritic joints that causes gingivitis. It's called P. gingivalis. You're 2 to 3 times more likely to have a heart attack if you have gum disease.
Oh, wow.
That's significant.
Yes,
And
it
I've heard
is.
that.
So then
I've heard that, and I've also heard, I know when my dentist checks me, he's brought in after the hygienist is done,
correct.
and he's checking for cancers.
Right.
Because,
Right. For oral cancer.
Mhm.
Exactly.
Mhm.
They're finding they're looking at the clot that causes a stroke, because you're also at a higher risk for stroke if you have untreated gum disease. And they're looking at that clot. And what are they finding in that? The same bacteria that causes gingivitis.
Wow.
P. gingivalis.
Wow.
Okay. The number one reason, or one of the number one reasons seniors are hospitalized, aspiration pneumonia. I know you've all heard of it,
Yes,
right?
Yes.
What's infecting their lungs? The same bacteria that's on their teeth, because it's not being removed. The teeth are not being kept clean, so they're aspirating it. Microaspirations, and it's setting up shop in the lungs. Dementia. Okay, this is the one that gets everybody's attention, right?
Mhm.
Yeah, I've heard this
A
recently, too.
long-term, low-grade infection, gum disease that's not treated, that's not taken care of, has been shown to increase the plaque tangles in the brain, which we know is one of the causes for Alzheimer's.
Goodness.
So everybody says, well, it's just your teeth. Oh, it's just your gums. The blood that's traveling to those infected gums is the same blood that's traveling to your heart. It's
Oh,
all connected.
yeah.
Medicine doesn't start in the back of the throat. It's everywhere. It's all inclusive.
So,
And the diabetes, especially, which you mentioned earlier, the bidirectional link of if you have untreated gum disease, you have a much harder time managing your diabetes, and the other way around. It's so true. Good point.
No, you were going to say you just spread something?
In regard to the inflammation of the brain that's associated with the bacteria from the gums, so the gingivitis
Correct,
creates
correct.
inflammation in your whole body.
It does. It is inflammation.
Mhm.
So, you can think about it. If you had a splinter in your finger and you left it there, what's going to happen? The tissue's going to get red, irritated, swollen. You take it out, well, it might bleed. It's no different than that bacteria that sits on the teeth that's not removed. It's going to inflame the gum tissues, cause them to bleed. It's an inflammatory process that's going on in your body, but you can see it, and it's preventable.
Yeah, and Mary, you just mentioned everything is connected, because I just read how sugar is, how can I put this? Part of the problem with people getting dementia. So this is making
They're tying
total sense
that
to
in
me.
now. A high sugar diet, as we all know, is not good for anybody. But you're correct. I have read that association as well.
But everything has sugar in it. Everything.
Yeah, you're right. You're right. Everything has sugar in it.
Yeah. Including
Yeah.
toothpaste.
Right.
And Snickers bars.
On a kind of slightly unrelated, I was listening to The Score driving over this morning, and they were interviewing, they're at camp, so they were interviewing one of the Bears players who has changed his whole diet to reduce inflammation in his body for a
there you
different
go.
reason. But inflammation,
Yeah.
we just don't always think about teeth and inflammation
Yeah.
and how it affects our whole body,
It's
do
the
we?
gum tissues. It's the inflammation of the gum tissues.
Yeah.
Your body doesn't know where that inflammation is coming from. It's just going to respond to it.
Ah,
So by going in and providing that weekly care,
Mhm.
we're reducing the cause of the inflammation and maintaining a better oral health, which then is better in turn, for the person, for the individual.
Do you have any kind of, without mentioning names, kind of any you can think about? I started here with this patient, and I saw a big difference.
Oh, well, how much time do we have? No, I'm just kidding. I have seen a great deal of difference in the clients that I see. And I have to say the ones that are very close to my heart are the World War II vets. I mean, I have to say, I feel very honored to be able to provide them care, and yeah, they deserve it. They, of course they deserve it. So those touch my heart a great deal. And then sometimes there might be an individual who just has that combination that, with the dementia and the Parkinson's. And I just, that's a really rough go, especially for the family.
Yeah.
So, but you see an improvement. Definitely.
Yeah. Now, you mentioned you talk to CNA students sometimes about this, and you had a great saying what you tell them about sometimes when the person with dementia is maybe not compliant.
Sure. So I do a lot of in-service trainings for CNAs, in memory care or assisted living communities, and I am on their side. They have the hardest job in the world, especially providing oral care. This is not easy. It might not necessarily be 100% in their wheelhouse, something that they're comfortable with. And I'm on their side, and I want to help them. And I'll say, who hasn't had maybe the resident who just clenches, and you can get the toothbrush on the outside. I say, congratulate yourself, pat yourself on the back. You got 50% of the mouth clean. Be proud of that. Be proud of that. It's better than 0%.
Sure.
So you have to kind of take what you can get on certain days, because as you know, individuals with, cognitive impairment, we don't always get to do everything we want to do the way we want to do it. We just kind of have to be with them where they are on that day.
Absolutely. In their world.
In their world, right. In their world.
And so can you tell us what are the top 3 things seniors can do to help keep their oral health as healthy as possible?
Sure. Well, I would say proper professional routine dental care, and to keep up with it, not to say, well, I'll just go once a year, or now that I'm retired, I'll be back in 3 years. Do not do that. Keep it routine, keep it what the recommendation is by your dental provider, so they can find problems small, and then they can treat that effectively, and be your own advocate. Find out, did I have any bleeding? Do you see any areas of inflammation? How are we going to correct that? I don't want to go into my 70s, 80s. I want these teeth, and I want to keep things the way they are. I want to keep it as healthy as possible. And that goes to oral hygiene care, top-notch oral hygiene care, and work with your dental, care provider, and what are their recommendations? Whether it's a manual brush, one of the many electric brushes, one of the many electric flossers, so to speak, whatever they recommend, find out what's going to work best for you. Everybody's different. Everybody's going to have their favorite, thing that they want to use. And then the other thing is just to limit the sweets. Well, we just talked about sugar, didn't we? Yeah. And it's the frequency. And I'll use this as a quick example. If I had the Coke in front of me, the giant Coke, and I'm sipping on it all afternoon, that's a constant sugar bath, okay? So every time that sticky plaque gets in contact with that sugar, it makes an acid, changes the pH in your mouth, which makes cavities much more likely, and will eat a hole in the enamel. And that's how cavities are formed. So if you're going to have that special treat, that Coke or whatever it is with your pizza or whatever it might be, finish it. Like, have it with your meal and finish it. Don't sip a sugar-sweetened beverage throughout the afternoon, because that is not really good overall for your dental health. Yeah.
Aside from dental hygiene, can you come over to my house and be my drill instructor? You're making me, and I'm hoping making our audience think about this as much as I'm thinking about this, because all the things you're saying I should be doing.
Okay, there you go. There you go.
And so you thank you for what you do, and we're hoping our audience is hearing all of this today.
That's great.
And so, I want to make sure that we mentioned it on the show, and it didn't happen before the show, because now I'm having problems with my time lapse. But you were saying before about how that gingivitis, how it affects everything in your body. So with the arthritis, as well as if you're choking and aspirating, then it goes to your lungs. So when did you talk about that? Was it before the show started?
No, it was during the show. during the show.
All right.
Yeah.
Because that's so important.
It
It's
is
just,
so important.
you know,
It
it's
is so
something that we've
important.
never thought about before.
Right. And I get that reaction or that kind of light bulb, aha moment quite a bit, when I bring that up.
Yep.
And it makes perfect sense once you start to connect those dots
Mm-hmm.
that, it's all connected. Everything's connected.
Sure.
Yeah.
Now, if someone maybe is at home and maybe they have a loved one that has dementia, or just
Sure.
maybe they're interested in doing a better job with their dental.
They want to
Dental health,
assist that
yeah.
person maybe.
So, what's some things they could do to improve oral care at home?
Sure. So I'll use this little scenario. So say the individual needs assistance with their brushing.
Mhm.
I would say wherever that person is comfortable, whether it's in a chair, it's a chair at the sink, wherever it might be, because you can use a cup or whatever, is to prepare everything ahead of time and have the toothbrush ready. I prefer to use with the clients that I see infant gel for a number of reasons. It's clear, it doesn't foam, it's safe to swallow, and it tastes sweet. Many of them are sweetened with xylitol. So you get that banana strawberry flavor or that bubblegum flavor. Sweets is that last, cents to go. So they really taste that sweet. And it just makes the job then a lot easier. To have everything ready, a very soft bristled toothbrush, the gel, you can use a hand over hand technique, let the person maybe hold it. You put your hand over theirs and you kind of do it, gently together. Maybe they're looking in the mirror. Maybe you're just sitting at the kitchen table. Let's face it, you got to do it where you can get the job done.
Right.
And maybe have a cup of water ready to rinse. I have many of my clients are able to take a sip, do a swishy, so to speak, and then rinse it back into the cup.
Sure.
But with the infant gel, there's no need for that because it's safe to swallow. So
Cool.
it works really, really well. It's very effective.
What's some good brand names that come to mind?
I like Spry,
Spry,
SPRY.
Uh-huh.
It's an infant gel, and there's also regular toothpaste. It's 100% sweetened with xylitol.
Mhm.
So xylitol, should I give a brief
Tell us what it is.
definition? Okay.
Yeah, tell
It's
us,
a
yeah.
naturally occurring sugar substitute. It's actually it's found in nature in a lot of fruits and vegetables, and it's made in our own bodies. It's made in our liver. Most of it comes from the cob of the corn here in the United States.
Oh, okay.
So what it doesn't do, it causes tooth decay.
Oh.
And it's a nice alternative for diabetics. They have candies that are sweetened with xylitol. In a lot of other countries, they use xylitol in place of sugar. You can bake with it 1-to-1, but it's not an artificial sweetener. I want to make sure I clarify
It's
that because
natural.
it's natural. It's natural.
Uh-huh.
It's a low glycemic index, so meaning it's safe for diabetics. So the xylitol really makes the toothpaste taste great.
How do you spell that?
Xylitol, XYLITOL. I actually had to do it with my pen.
Xylitol.
Well, I went to the next round of the spelling bee.
Well, I'm glad I asked. I had it all messed up.
Yeah.
We had it
Yeah. Phonetically, yeah.
So for those in our listening audience that has a loved one that's in memory care now or assisted living, how can they ensure their loved one is getting proper oral hygiene?
Sure. So this is my world because this is what I do.
Mhm.
I provide the weekly oral hygiene care for my clients, and most of them are in memory care communities. So if it's an activity of daily living that they can't do themselves, it needs to be provided for them. So ask, who's providing this care? Get a name. I would say get a name.
Mm-hmm.
Who's brushing Bob's teeth in the morning and who's brushing Bob's teeth at night? How often? Is it happening both times? Is it happening just once? Maybe the mornings aren't working. How are we working with this?
Uh-huh.
What training did that caregiver receive? How is your loved one responding to it? Is it a constant battle? Is it a constant fight? Or is it really successful and it works like a charm and there's never any problem? What steps are being done to make sure that that's happening, that it's a success? Again, there's no such thing as a perfect world. I understand that. It might not be perfect every single time, but the attempt should be made on a routine basis for that care to be provided.
Very good. So before time gets completely away from us, could you share your contact information that you would like people to use in reaching out to you?
Sure. Again, so my name is Mary Jensen. I'm a registered dental hygienist, and my tagline is I'm bringing oral care to elder care and memory care.
I like that.
You can reach me on email, would probably be the best, Mary Jensen, JensenRDH @gmail.com.
Say that one more time.
Okay,
I'm gonna write
Mary Jensen, and Jensen is spelled Jensen,
this. Uh-huh.
RDH, registered dental hygienist,
Yes.
at gmail.com.
At gmail.com. And you kind of go, you have a pretty large coverage area.
I do. I've been doing this for 4 years. And when I first started out, of course, I wanted to help everybody,
Yes, of
so
course.
Yeah.
anybody who needed help, I drove there, to help as much as
Wow.
I could. So, but the majority, I would say the majority of my area is definitely the western suburbs. So
Western suburbs.
Yeah.
Okay. Right in our wheelhouse.
yes.
Mary, I'd like to, since we have a little bit of time, somebody that's aging, going to the dentist right now, being cared for,
Mhm.
are there some things that they should be asking their dentist about the aging process?
Sure. A lot of times there are, there's at least 300 different medications that cause dry mouth. So maybe find out if through the dentist or, the pharmacist or your doctor, are any of these medications, is that a possible side effect? And the reason why I bring that up is that decreased saliva increases cavities. Saliva is really a miracle fluid when you think about it, because it naturally cleanses everything in your mouth. And when you don't have it, the pH can change dramatically, and it can cause cavities. So, I'm sure everybody's heard, they went through chemo or radiation and they got so many cavities from that. Well, it's because that changed everything in their mouth because of the dry mouth and everything. So I would say start there, and then I would just say be on top of your preventive care. Make it a priority. Make it a gift to yourself to take care of your mouth. You take your car in every 3 months for the oil change. Well, maybe take yourself in every 3 months to have your oral health evaluated. Maybe you don't need a cleaning every 3 months. Maybe you're good with every 6 months, but find out where that happy spot is, where when you go in, it's healthy. Not you go in and, there's 5 problems. Yeah.
Right. And I that's great input. Audience, I hope you're listening here. Okay, so the one other question I had, is there one other question we should ask dentists? Are there dentists that provide their hygienists to go to the homes and stuff like that?
Well, the laws in Illinois don't allow me to provide dental hygiene care in said communities, in memory care communities, without having a collaborative agreement with the dentist who's done an exam on said patient within a time frame. We're working on it in Illinois. The laws are slowly getting changed, where there will be a public health dental hygienist who can then provide this much needed care for our seniors.
Absolutely. And thank you for saying that, because let's talk to our representatives. That's what they're there for.
Right.
And with you mentioning the chemotherapy and everything else that affects our bodies like that, let's
Absolutely.
pay attention to that, because as you said before, oral care is the first step.
Right.
So
Mary, I want to ask Mary a
go
question.
ahead. Yep. Go ahead. You go for it, girl.
Yes, Jeanette.
So when you're a senior, who pays for dental care?
Right. So many seniors lose their insurance benefits when they retire,
Right.
unless they've purchased, like a supplemental insurance. So it is out of pocket. Medicare does not cover dental. There's very little coverage even with Medicaid for
But you were
dental.
saying that it's considered an activity of daily living.
Oh, so I'm private pay by the families. The
Right.
service that I provide is
Mhm.
private pay by the family.
But oral hygiene is considered an activity of daily living.
Correct. In a community.
Okay.
Yes.
I see.
Yes. So the staff at the community should be providing that care for the loved one. The brushing, the oral hygiene care.
Yeah.
So there is not like maybe a link between poor oral hygiene and poor health.
Right.
There is a proven link
Yes,
between
yes,
ignoring this and having ill health effects later on.
yes. I mean, you can tell sometimes the overall health of an individual by looking in their mouth. You really can.
Cool.
Just think of it as it's just another way to stay healthy. The healthier your mouth, the healthier your overall health.
Thank you so much, Mary.
Oh, you're very welcome.
Thanks for being our
Happy to
guest.
be here.